The following portion of Studio 512 is sponsored by Texas Heart and Vascular. Heart disease remains the #1 cause of death for Americans each year. Here to educate us on the importance of good cardiovascular health is Dr. Nathan Boyer, interventional cardiologist at Texas Heart and Vascular. Dr. Boyer, how can folks stay on top of their heart health, and how often should folks be getting checkups?
There are a lot of simple things that people can do on a day-to-day basis that will keep your heart healthy. Maintaining a healthy weight through regular diet and regular exercise are excellent things that you can do to just keep your heart in good shape. It's important to see a cardiologist or your primary care provider probably about once a year. Basic lab work including cholesterol, blood sugar levels, vital organ function are key things. At Texas Heart and Vascular, we have a comprehensive cardiovascular service line where we can help you out with those things. So if you need to see a cardiologist, give us a call.
How about some common myths that you tend to hear from patients when they walk through your door?
Sure. One of the most common misconceptions or myths that we hear from patients is that my parents had heart disease or my siblings had heart disease, so I'm destined to get it too, right? Well, that's not the case. There are a lot of heart risk factors that are modifiable, like blood pressure, cholesterol. While genes are an important part of your heart health, it's not the only thing. And so if you have those genes in your family, you've got family members who do have heart disease, it doesn't necessarily mean that you're going to have it too, but you need to get in and see somebody and make sure that you're staying on top of your heart health.
Sounds good to me. Okay, what are some of the newest treatments available in your field? I'm excited about this because for those of us who are just, regular pedestrians here on the street, we don't know about some of the advances in cardiology.
Yeah, one of the most really exciting fields in cardiology right now is the field of structural cardiology. And structural cardiology is a field where interventional cardiologists like myself work closely with heart surgeons, and we try to think of ways using tools and techniques that are modern to replace and repair heart valves through different access sites that don't require open heart surgery, usually using the arteries and the veins in the leg. One of the really exciting procedures that's emerging in this field is called TAVR, which stands for transcatheter aortic valve replacement, where we actually take a heart valve, go through the artery in the leg, and inside the original heart valve, replace a new heart valve. It works on a beating heart. It's done while the patient is under conscious sedation. With this procedure, people usually have a much faster recovery time, and we get surgical-like results.
I was going to say minimally invasive has to be compared to what was.
Definitely the way to go.
All right, doctor, I appreciate your expertise today. Thank you.
Thank you.
To learn more about the cardiology care services offered, go to thandv.com. The preceding portion of Studio 512 was sponsored by Texas Heart and Vascular.